So what is a facelift? Well, a facelift means lifting up all the tissue of your face. So as you get older, you lose elasticity to your skin, and so that skin starts to sag down, both in the middle of the face, along the jawline, and your neck. This can be in varying degrees. If you catch it really early, maybe even in your late 30s, just doing small procedures can tighten that skin back up, even with things like Face Tight and Morpheus that I have in the office is minimally invasive. Once there's enough skin laxity though, a facelift is really your best option. And when I say facelift, that incorporates the neck as well. I can do an isolated neck lift if you're not wanting to address the face, but a facelift usually involves the neck and the face. So what is the procedure like? So I do a facelift under general anesthesia. It takes about 3 hours because it takes a lot of time to lift up all the layers of tissue that you need. The incision is quite large, so it goes from in the hair on the side, around your ear, and around this little guy called the tragus, in the crease around your earlobe, and then back behind your ear and into the hair down here. If you have banding, called platysmal banding, it's two flat muscles in your neck that tend to give you that jowl look. Sometimes I have to suture that muscle together, and if I need to do that, then I make a small incision under the chin here. Those incisions heal very nicely, hide really well, but they will stay pink for a while. These incisions give me access to all the rest of the face, and so most people are afraid of a facelift because they think they'll look too tight, but what people have that cause them to look too tight is if you're just tightening the skin itself. And really a facelift means tightening the layers underneath the skin. So there's a layer called the submuscular aponeurotic system, called the SMAS, and that's the layer that I'm really pulling up. And any extra skin after I've tightened that layer just gets trimmed and set aside. So what are the risks of a facelift? Where the main risks are pretty routine: bleeding, infection, numbness, getting a collection of fluid underneath the skin. I don't see that very often with the technique that I use, and therefore I don't really need to put drains in place. If there is a pocket of fluid that collects, I can basically use a needle to drain that. Those are the things that happen in the first 24 hours. So I like to see you back after the first 24 hours, so the day after surgery, to take down the dressing and take a look at everything. Some of the later risks mean having a scar where all the incisions are, or some tethering of the earlobe. You can get some lumpiness under the neck if too much fat is taken. So I do incorporate some neck liposuction just to contour the jawline during a facelift. If too much fat is taken, then sometimes you can get some tethering of the skin down. So I have to be careful just to balance, a nice contour jawline, but leaving enough fat underneath the skin. Those are the main things. There is, a very, very small risk of nerve damage. So the nerves that move the entire face live kind of in a spider web looking design on your face. So I'm very careful to work in the right layers around those nerves. So I've never seen any permanent nerve damage, although you can have some transient or temporary nerve damage just from stretching and swelling. What is recovery like after a facelift? Well, it's not an easy process. So you'll be very swollen and bruised for the first 1 to 2 weeks. The bruising will gradually work its way down onto your chest because gravity will bring it down onto the chest. Just because you have stitches underneath the skin, you can see a little bit of dimpling, and that goes away and softens over time. And then you'll have stitches within all the incisions for a week, which comes out after a week. I usually have you wear a compressive dressing for at least a week for 24 hours a day, and then after a week's time, you can wear it at night while you're sleeping, just for a little extra support. Your final result you don't really see for at least 6 weeks to 3 months even, and you'll see things just kind of settle into place.